Hi Gabrielle, my name is Wendy Nixon, and I really enjoyed your post. I like your statement that medication-assisted therapy, MAT, is becoming standardized treatment, and I as well found that from the National Council for Behavioral Health, a summary sheet that described MAT as evidence-based. Also, you focused on the stigma that can come with identifying and treating substance abuse. The MAT is geared toward opioid addiction, and it seems that this does carry the greatest stigma in my experience. Even among those struggling with substance abuse, IV drug use and heroin use is seen as very serious and stigmatized. For example, I have heard those who struggle with smoking marijuana say that they would never, quote unquote, shoot up or use hard drugs like heroin. In reviewing some literature, I found an article about MAT in rural areas specifying issues of stigmatization. This was in the Journal of the American Medical Association 2019, specifically addressing rural drive times, but overall just rural communities and the stigma that comes in these areas. Um, this article was by Judney, Eidelman, and Wang, and they specifically addressed how the stigma of substance abuse has hindered the expansion of MAT programs. I do live in a rural community, and I have seen this in my community as well. We had a methadone clinic open about 4 to 5 years ago, and this was not really publicized, and even among the professionals in the community, it was generally not circulated. I was unaware of it and was surprised to find out that it had been in operation. So I really wondered if there was, community resistance to even this program opening here in my community. I know that there was significant resistance to a Teen Challenge program opening here to address substance abuse several years ago. So I think maybe people just don't want to accept that this is an issue, even in our community. You made a strong statement about psychotherapy being a needed component in conjunction with medication-assisted treatment for effective treatment, and I really agree with that statement. I was even able to find research in our textbook that generally documented that conjunctive therapies such as cognitive behavioral therapy um, are effective along working with MAT to help people struggling with substance abuse. However, I did find an article that by Sheridan in 2017 that quoted Dr. Nora Volkow, director of the National Institute of Drug Abuse, NIDA, as saying that studies generally report that adding psychotherapy or cognitive behavioral therapy had no effect on the outcome of buprenorphine and methadone-based treatment. So again, this was just very surprising, and I wondered if the standard of no relapse was just simply all they were looking at versus are these individuals really dealing with the underlying issues and addressing their emotional pain. In fact, I did collaborate with a colleague in the community on a client that went to the methadone clinic here, and they received no conjunctive therapy, and that was not required. So all very interesting issues, and thank you again for your post.